Hi, good afternoon, everyone. It's nice to be here again on Doctors Go Live. Hope you all will always be with us because we've got a lot of exciting content for you. For example, today we're going to be talking about rectal bleeding. Okay, so not we still have to talk about these things because it's very important. Sometimes when you have blood coming out through your anus, sometimes it might be a serious matter, but sometimes it may not be a serious matter. But because we don't know, so we need professional advice. So who do we speak to? Today we'll be speaking to Consultant General Surgeon of Columbia Asia Hospital Iskandar Puteri, Dr. Zulkarnain Hasan. Assalamualaikum. May I call you Dr. Zul?
Yeah, please, can.
Okay, that's good. Okay, let me just make the introduction. So seeing blood in the toilet bowl, toilet paper, or stool can make you feel anxious and think of the worst. Fortunately, not all causes of rectal bleeding are life-threatening. Okay, before we go into the details, maybe doctor can enlighten us and the viewers. What exactly is rectal bleeding? Silakan, doctor.
Okay, good afternoon, everyone. Today we're going to discuss a little bit of what rectal bleeding is and what are the causes and what, as a doctor, we will do to further check what are the problems that happens to you. Okay, by definition, the rectal bleeding is when someone passes blood through the anus. So basically, we can say it a misnomer. Even though the terminology called rectal bleeding, the blood actually comes out from our passage or anus. And the results can be a bright red blood, or sometimes in doctor's term, it can be a black color stool. All right, and the bleeding sometimes may not be visible by our naked eyes, but it can also be put under term of rectal bleeding. Okay.
Oh, I see. Okay. So even if it's just liquid that you cannot see, it's also considered rectal bleeding.
Yes, anything, any blood, and this blood can comes in many appearance. It can come as a fresh blood. It can come mixed with feces. It can come mixed with some mucus that comes out, and also it can come before someone going to the toilet, or during
Yeah.
passing motion, or even afterwards, or even it can come out as staining in the underpants.
Of course. So each of the color of the blood that comes out will be caused by different things lah.
Yes, there are different causes of this bleeding. So
Okay, all
today,
right, let's take a look at the causes.
yeah, actually, there are our rectum or anus is part of the digestive tract. Our digestive tract actually started from our mouth, small intestine, stomach, small intestine, and then large intestine, and then the large intestine. At the end there's a structure called rectum and also our anus. So the bleeding can be from anywhere from this tract. And also we can see that the bleeding itself can come from the anus and the perianal region, or even further inside. Okay, and we look at the most common bleeding that can happen in our community is actually what we call hemorrhoids. Unfortunately, because of this common occurrence, most people thought they were having hemorrhoids, but actually they are having other problems. In the Western community, probably if you ever worked there, or I worked in Ireland before, and from statistic, it is said that the commonest bleeding of rectal bleeding in Western community is diverticular disease. Okay.
It's what?
It's called diverticulosis.
What is that?
You can look at the photos there. Actually,
Okay.
you can go one by one. In the anal region, you can have anal fissure. Anal fissure is the cut in the perianal region. This actually usually happen because someone passing is having constipation, passing out fast stool, and that cause injury, and that injury will
Yeah,
cause
yeah,
bleeding.
yeah.
And
Kalau teran lah, I think that's
yeah,
another
yeah.
term for it. Okay.
Then further up, you have hemorrhoids, which
Mm.
is what commonly people will come and see doctor. They thought they were having hemorrhoids. They will say, "Doctor, I have hemorrhoids." They're not
Yeah, yeah.
even mentioning they are having rectal bleeding.
Right.
Diverticulosis is actually some abnormalities in the intestine. This is also because of prolonged constipation. What happens is the intestine become high pressure, and this pushes out or the intestine balloon out. You can imagine like an old tires. There's a balloon coming out from the old tires. I always compare this like an old tires that something balloon out, outpouching of the intestine, and this cause weakness and bleeding. From the intestine also, another common one is what we most fear is cancer of the colon. Okay.
Okay.
Sometimes, yeah. Okay, this is, you can go to the next slide. You can see this is a clearer appearance of a diverticulum. Okay. Where there is an outpouching of the intestine. And you can see from the photos, there are a lot of blood vessels in the intestine, and this blood vessel can rupture, causing bleeding. Okay,
Does the blood
and
vessel to rupture?
the blood vessel rupture because of repeated injury and also stretching of the
Stretching.
stretched.
Yeah.
Yeah, and
Oh, I thought like
commonly
physical exercise stretching. No, not that kind of stretching.
and normally people who have this as a problem with their stool as well. They don't take enough fibers and their stool are hard, and this
Mm.
also can cause injury and causing bleeding. Okay, the next slide is you can see actually this diverticulum also can have infection, um, and this infection can also cause bleeding. Okay. All right. And there's another a bit uncommon cause of intestinal bleeding or rectal bleeding in our community, which is called inflammatory bowel disease. I'm not
Yeah.
going to go through detail, but this is a group of disease whereby the intestine is attacked by our own antibody, and this causes inflammation of the inner lining of the intestine, and this inner lining is easily bleed. Okay.
Okay.
Okay, you can go to the next slide. There are two types of inflammatory bowel disease. One is ulcerative colitis. Okay, and another one is called uh, Crohn's disease. Okay, and you can go to the
Wow.
next slide.
What's the difference between these two?
Ulcerative colitis, as the name implies, it only occurs in the colon. The word colitis means colon, but the Crohn disease can affect the whole digestive tract, from the anus up to the mouth.
So
Or,
Crohn disease is see?
yeah, Crohn disease is more extensive and can be more
Mm,
severe than the colitis, ulcerative colitis.
I see. What causes inflammatory bowel disease? Is it the kind of
Inflammatory
food that
bowel.
we eat?
It is a kind of autoimmune disease whereby our body produce antibody and it attacks our own intestine.
I see. I see.
Okay,
Okay.
you can see in the photo the surface lining of the intestine
Yeah.
appears very friable and easily bleed.
Yeah, bumps. They're like little bumps.
Yeah,
So where does the blood come from?
the blood actually comes from because of the surface of the inside of the intestine very friable, and
Mm,
when the injury, this injury will cause a bleeding.
okay. Okay. I see. All right. Doctor, can I just
Okay.
ask, would someone's lifestyle contribute to rectal bleeding? Meaning, if they like to eat spicy foods, very hot foods, ataupun if they like to, okay, if they go to the toilet and then they squeeze, the anal passage, that one, yeah, you mentioned just now that might cause a fissure, eh? I think that's what you call it. Okay.
Yeah,
Okay, so
basically, it is related to our lifestyle and diet
how
because
does it relate to that?
mainly people who doesn't take enough fiber in their diet, this will cause the stool to become harder, and also
Yes.
people who likes to hold too long when they have the feeling urge to go to the toilet, and this will cause the
Yeah.
stool to become harder and will cause bleeding as well.
Yeah. Apart from fiber that you have to take in, but what about the types of food that you eat? For example, as I mentioned just now, maybe too many chili padis, like how Malaysians love their spicy
Um,
food.
this is what most people believe, but this spicy or hot uh, with a high content of chilies does not really contribute to this kind of condition. It is mainly because of lack of fibers, lack of fluids in the diet, holding too long. If someone has an urge to go to the toilet, eat too much red meat as well. Okay, so
Okay.
spicy
All right.
really combined with lack of fibers and fluids that contribute to these kind of conditions.
Okay. Right. So that's more fruits, more vegetables, drink a lot, don't hold it in.
Eat
Good.
healthy food, basically.
Eat healthy foods. Okay, that's very good. Okay, are we still looking at the more causes of rectal bleeding?
We can go through some of the common one. We can see at the next slide. We have anal fissures. I think we just go through the slide. Anal fissure is basically like an ulcer in the anal canal. As I said earlier, this is caused by hard feces passing through the anus. Sometimes it can happen to people who probably eat too spicy food that they have to go repeatedly and forcefully to the toilet. That can happen, but most of the time it is because of hard feces causing stretching and injury to the. And this kind of bleeding will also be associated with pain. So when someone comes and see a doctor, we will ask them, okay, is it painful or not? So we can narrow down what are the common causes of painful rectal bleeding and also painless rectal bleeding. Okay, you can go to the next slide.
Oh, there is such a thing as painless rectal bleeding, eh?
Yes, most of the time it is painless. When it is painful, there are a few conditions that can cause painful rectal bleeding, such as anal fissure. Okay,
Okay.
and if it is painful, then as a doctor, we have to be careful when we try to examine and check the area, because if we are not careful, this will cause further pain to that person.
Okay.
Okay, and this is hemorrhoids. You can see
Yeah.
hemorrhoids is the probably the commonest cause of rectal bleeding in our community, and most of the time hemorrhoid bleeding is painless, and also the characteristic feature is it can cause splashing of blood in the toilet bowl. Uh, and most of the people will be scared when they see this, the toilet bowl is filled with blood. Um, and the most of the time, the hemorrhoid which is bleeding is inside, which we cannot see from the outside. You can see in the photo there, the internal hemorrhoids which cause this bleeding. And most of the time, bleeding is painless.
Okay.
Okay, but
Dr. Hemorrhoids is actually, maybe we can just quickly go through what exactly is hemorrhoids also, so that people understand where it comes from and why it bleeds.
okay, hemorrhoids, you can see the photo clearly. It's actually part of the structure of the normal what we call anal canal. It is a blood vessel which can expand and can shrink. Actually, it is part of the control mechanism for normal passing motion. But this vessel, when someone uh, has a hard stool, number two, they like to force when they going to the toilet. This vessel will expand and become bigger in size. And when it become bigger, it can easily get injured when the stool passing on the surface of the internal hemorrhoids. This can cause injury, repeated injury, and then cause bleeding. Okay.
I see.
You can see the other symptoms associated with hemorrhoids, itching, mucus discharge, because this thing is expanding and become bigger and start producing some mucus. The mucus comes out from the anus. This will cause itching, burning sensation, and sometimes if the hemorrhoids become thrombose, blood clots form inside the hemorrhoids, it can cause pain as well.
I see. Okay. Okay, right. I understand there's another slide about hemorrhoids.
Yeah. Okay. Hemorrhoids. Normally, we will grade the hemorrhoids into 4 different grades, but this is for general people. It is not really important. It is mainly for a doctor, because this is how we want to plan our treatment. So basically, grade 1 is the hemorrhoids is still inside. The person will come only with bleeding or itchiness. Okay, grade 2, once the hemorrhoids is bigger in size, it starts to come out when someone passing motion, but it will go inside afterwards without having to push the hemorrhoids. Grade 3, if the hemorrhoids actually comes out, and that person needs to push it up inside. Okay, and grade 4, when the hemorrhoids actually stay outside and cannot be pushed back in. Okay, and when the hemorrhoids in grade 4, actually we have to do immediate procedure so that it will not cause any other complications. Mainly it cause pain, it will cause difficulty in passing motion, and infection, and so on and so forth.
Doctor,
Okay.
when hemorrhoids is at stage 1, you can already see the bleeding. I mean, is that how a person can tell that they
Yeah,
got
the
see
normal
doctor?
complaint for grade 1 is bleeding. But when we examine the
Sorry?
anus area, it is actually, we can't see anything from the outside. We need to do a procedure called proctoscopy, at least, to see whether there's a hemorrhoid inside.
I see. Okay.
Mm.
Okay. All right. Okay, let's see what we can do. Let's see what doctors can do. Oh, not yet. Okay. Let's take a look at colon polyps.
Okay. So hemorrhoids, if we want to discuss, actually hemorrhoids, different stage of hemorrhoids, different kind of treatment. Grade 1, we can treat with medicine, adjust and change the diet, take more fiber, drink more fluids, do not strain too much when passing motion, and also normally as a doctor we can prescribe medicine to help reduce the bleeding and size of the hemorrhoids. But the long-term measures to prevent this is that person need to change their lifestyle altogether. If they, after seeing a doctor, they consume medicine given by the doctor, but they don't change their lifestyle, this hemorrhoid will keep coming back. Okay, grade 2, grade
Lifestyle
3,
diseases.
yeah. Actually, the main thing is to come and see a doctor, and then we will explain to them what are the options available for treatment of hemorrhoids. Preferably come early. Don't let the hemorrhoids become stage 4. If the hemorrhoid goes into stage 4, then we probably have more complications. Need to do more complex surgery. You see, so early
Okay.
consultation is better. The
All
next
right.
one is polyp. Yeah?
Mm.
Polyp is actually part of the intestine. You can see from the photos. These are different kind of polyps inside our intestine, and you can see the polyps is actually something abnormal. protruding out from the intestine, and this can easily bleed. You can see the polyps appearance as a blood vessel, okay, on top of it. Okay.
So polyps are growths?
Polyp is growth inside the intestine.
Okay. They may or may not be dangerous.
It may or may not can be dangerous, can be something not dangerous or benign.
Okay.
Yeah.
All right.
Okay. The next one is actually can go to the next slide. This is the one that we fear most. This is
Ni takutnya dia.
cancer, yeah, cancer of the colon, cancer of the
Yeah.
rectum. Okay.
This looks very advanced, doctor.
Yeah, this look very, as a doctor, we call it looks very angry looking cancer.
I see. So ni lebih kurang stage apa ni? What are we looking at?
Okay, so we can't really say what are the stage of cancer. We can see, even by appearance, we can't say it is cancer. This is labeled as cancer because we already done further tests from this so-called tumor. What we'll do is we'll take sample and send to the lab to confirm whether it is a cancer or not. And then from
so
there,
it's not just a matter of looking at it, but it does look very angry, doctor.
yeah, we can probably suspect information by doing a biopsy. Can go to the next slide. We can also have ulcer inside the intestine that can cause bleeding. Okay.
Looks very painful.
Yeah.
All the pictures so far, they look very painful.
This is also caused by heart feces. So basically, heart feces or stool can cause a lot of problems. Can cause hemorrhoids, can cause anal fissure, can cause ulcer in the rectum. Okay. Next one. Okay, this is infection of the intestine. You can see these are also ulcer, but superficial and small ulcers in the intestine.
How does one get infection?
Infection can be caused by many factors from food, from diet. Okay, mainly from yes.
Oh, okay.
So what happens is the bad bacteria accumulate in the large intestine, causing infection, and this is one of the appearance of the infection of the large intestine.
Doctor, so since we are on the subject of intestines, if we take probiotics on a regular basis, will that help keep all these things at bay, especially when it comes to infection?
Yes, exactly. Actually, probiotic is part of our natural defense mechanism in the intestine. What happens today is our diet has a lot of preservative and processed materials actually that kills this bacteria. And again, go back to our diet, when we don't consume enough fibers, these fibers are actually food to our good bacteria called probiotics, which we call prebiotics, the food for the bacteria. If someone doesn't take enough fibers, this bacteria will not survive or become reduced in number. And when this bacteria reduce in number, there are many problems that can happen. We can have all these intestinal problem, reduced immunity, and so on and so forth.
So would you recommend supplements? Would you recommend probiotics on a daily basis?
Something that I would personally recommend, because we do not know in today's lifestyle, we don't take enough fresh food, and we're taking probably too much of processed food that destroy our good bacteria.
But we could possibly take a natural antibiotics and natural probiotics like yogurt.
Yeah, there are probiotics in yogurt, in special drinks like vitamin.
Okay.
Okay, and there are some dried form. There are this different preparation have their own advantage and disadvantages. Okay.
All right.
Okay.
So we can move on to the next slide. Other causes.
this one, I just want to share some other uncommon causes of rectal bleeding. It's just to share. It is not very common. I've never seen this angiodysplasia. Okay, so don't have to worry about it. Just to show, to share. You can go to the next slide. How this angiodysplasia is actually an abnormally formed blood vessel inside the intestine, and this blood vessel become bigger, tortuous, and easily bleed. Also related to again, if someone having heart stool, this easily bleed because it rubs on the surface of the intestine and cause bleeding.
I see. Okay,
Next slide.
doctor.
Yeah.
Out of all the causes that, oh, there's one more. Okay, okay. Let's finish this up first.
This just
Let's do all the causes.
these are also other uncommon causes. What we call ischemic colitis. What happens if someone having, for example, diabetes or having problem with the blood vessel, blood supply to the intestine become blocked, the intestine having ischemia, and this can also be. This is very uncommon causes. Okay, the next one.
Banyak causes dia.
A lot of causes.
A lot of possibilities.
Yes, that's why if someone having bleeding, they need to come and see a doctor immediately, because if someone self-diagnosed, think okay, I might have this, but then they can have something else, and if that condition is handled and treated early, it can be life-saving. But if it is left alone without proper treatment, that can be can cause more complications. Okay, so these are other yeah. We don't have to go through. Just want to show this photo. There are actually other causes of rectal bleeding, which we need to consider. Okay, you can go to the next slide.
Okay, doctor, before we talk about when do we need to see a doctor, this rectal bleeding normally, does it happen in a certain age group or just, across the board?
Actually, it depends on the causes. It can happen to children, even babies, to elderly, and there are different causes in different age group. Okay. For children, probably one of the common causes, like I shown in the earlier slides, which is intussusception. It is because part of the intestine telescoping into the small intestine because of infection, and this condition can cause rectal bleeding as well. In adulthood, probably the commonest cause is hemorrhoids in our community. In elderly, probably diverticulosis or diverticulitis is one of the common cause of rectal bleeding. And you need to consider other causes, polyp and cancers as well.
Doctor, you mentioned much earlier in the show that in the West, hemorrhoids is not one of the common causes of rectal bleeding, but it is so in Malaysia.
Yeah, it is common, but diverticulitis is more common than hemorrhoids. From the
is there a reason for that? Why people in that side of the world have a different cause for rectal bleeding, whereas in Malaysia we have a lot of hemorrhoid cases?
Probably this is based on what called textbook. Probably because we used to be our diet, staple diet used to be a lot of fibers. We eat a lot of fruits and vegetables and in our diet. But I think probably we have to reevaluate this situation again because our diet is becoming westernized these days. Yeah.
I see. Okay. All right. So let's take a look now. When one experiences rectal bleeding, what can we expect a doctor to do?
Okay, when you come and see a doctor, what we will do is we will ask few questions, what we call getting a full history, because we need to know beforehand what are the possible causes, as we discussed earlier. Different causes have different kind of symptom, and then we'll do a thorough examination. We probably need to examine your stomach, abdomen. Probably we need to examine the perianal area to get a correct diagnosis. The most important thing is to get a correct diagnosis. Sometimes, especially if you see a specialist, we probably need to do further tests, such as we need to do an endoscopy to get to a proper diagnosis. With a proper diagnosis, that is what is most important thing to do. Then only we can give the right treatment. Okay.
Okay.
If you're seeing a general practitioner or coming to the emergency, if you're having bleeding at odd times, then the doctor from the emergency will give proper advice, probably refer you to that person to see a specialist for further treatment. And the next slide, we will probably perform some basic tests, okay, to find out, because the bleeding, apart from what we were discussing earlier, there are other causes of bleeding which are not because of the GI tract. We need to see whether this bleeding has also caused complications, such as if someone is bleeding a lot for a long duration, that person might have lost some blood. So we need to check. Our patients coming to hospital when the hemoglobin level drop to half of the normal body hemoglobin because of repeated bleeding, and that person is very is afraid to come to hospital. We need to check the liver function, kidney functions, and also we need to check whether the blood is clotting properly or not.
Yeah.
Okay.
Doctor, when you mentioned just about rectal bleeding, and then yeah, I understand that you did say it could be spotting, stains, and whatnot. But has there ever been a situation where there is a lot of blood? Meaning, like, how much are we talking about when things are really chronic? Because you mentioned just now about checking on someone, tengok dia punya level of hemoglobin, kan? So are we talking? Has there been cases of a lot of blood coming out of the anal?
It can be quite a lot actually. If someone, there are different people have different what we call it, attitude towards rectal bleeding. Some when they saw the blood, next time they went to the toilet, they refuse to look at what's coming out. They know the blood and they say, okay, better not seeing, as if assume there's nothing there. So they keep on bleeding, and then they will lose blood every time they pass motion. Okay. And also some people they bleed, but they are too afraid to come and see a doctor, or they feel embarrassed to see a doctor.
They feel what? Say again?
Embarrassed to see a doctor.
Yes, I think that's also another problem, doctor, because I think sometimes Malaysians can be a very shy lot of people, that when it comes to like personal areas, kind of like the illness. So but what can you advise people in order for them to not be shy and come forward and talk about this with their doctors?
Actually, we have to be aware some of the dangers if you don't get a proper treatment. It can be just a simple illness like hemorrhoids probably, and the treatment can be pretty simple. Just change diet. Doctors probably might give some supplement of something to soften the stool, and there's a very good medication to treat the hemorrhoids without having further problems. This is what we call a very straightforward.
Okay, so jangan takut and jangan malu. Sakit means sakit, and you have to go and see doctor. Okay, doctor. So what is this? If you are looking macam apa? Macam headphones, doctor?
This is actually a device we use to help us to visualize what is happening inside the rectum.
Okay.
Okay. We not use this. We depends on cases. We don't do this in all patients that comes to us. Okay.
This is called colonoscopy?
Yes, this is called
is this used in colonoscopy?
This is called proctoscopy. The name is there, proctoscopy.
Oh, okay.
Okay, right. We can go to the next slide. Okay, and okay, then from there we will do further evaluation. Actually, every patient are different based on the stories or what we call history, based on the physical examination. Then we will advise what we need to do next. Okay, next slide. Sometimes we need to do a scan. This is just an example, okay, to find out what are the causes of this. Depends, not all. Okay, next. Okay, then, okay, this is okay. If we want to find out what actually happens inside, as a specialist, we normally can do a procedure called endoscopy. Okay, this endoscopy we can do for several reasons, either for screening, if someone has a history of family history of cancer, if someone having abdominal pain or bleeding per rectum. Okay, we can detect inflammation, infections, ulcers, and also diverticulosis that I mentioned earlier. Other conditions like intestinal narrowing, polyps, and also cancer. Okay, endoscopy is just a flexible tube, and the size is small, about 1 centimeter in diameter, also. And this is connected to a video scope, and then we'll give medicine, so that person will be sedated. Sedated meaning that probably half asleep. So we can perform the procedure by putting this flexible tube into the large intestine, and then we can see clearly what is the problem.
Okay, it goes all the way into the large intestine.
A large intestine. If possible, sometimes we be able to see the end part of the small intestine. So these are the description what we will do. We give medication to for sedation. We will monitor the person, give oxygen if necessary to help the patient breathe easier and more comfortably during the procedure. Okay, these are just showing how the endoscope moves along the intestine. So basically, it's called a direct visualization of the intestine. The most accurate way of seeing what is happening in the intestine, finding out what are the causes of bleeding. Okay, if we find something that we need to analyze, we can take the sample. Like earlier, we saw this mass cancer. We can take a sample. If there's a polyp, we can actually remove the polyp as part of the treatment. So this colonoscopy is what we call it, something to check, and also can be used for treatment.
At the same time?
At the same time.
That's convenient.
Okay, so some of the problem can be solved by doing colonoscopy.
Yeah.
So if someone coming for...
I'm just curious, how long is the human intestine on average in adults?
Our large intestine is about 1.5 meter in length.
1.5 meters, okay.
1.5 meter.
Okay.
So the endoscope is about that long.
I see. But what if there are... Okay, so that's endoscopy. But what if there are complications in the smaller intestines? How would you find out? Is that through colonoscopy?
In small intestine, actually, we have 2 ways to see. One, there's a special endoscope into the small intestine. We call it enteroscope. And another way is doing what we call a capsule endoscopy. That person will swallow a pill with a camera inside, and that camera will travel along the small intestine, and that will send, the camera will send a video to a computer which will record the procedure.
So you swallow the camera?
Yeah, swallow the camera. The camera is very small. I don't have the, but you can look in internet. There's a small, about probably 1.5 centimeter in size, like a pill, and you swallow it, swallowing a pill.
Oh, that's a new
And
one.
this is,
So it's one off lah. After that, you don't get it back
oh,
anymore.
yeah, this is
Oh, and you pass it
the
out.
camera.
That's it.
Yeah.
Can you see it with the naked eye?
Can
Before you
the camera?
swallow?
Yeah.
Yes, the camera.
Yeah.
Wow. Oh, that's new. Fantastic. I tell you, it's health
Now
technology.
we have
Okay.
very high-tech technology in our services.
Mm.
I think one of the colony Asia has this capsule endoscopy. It's not available here. It can be done as outpatient. Swallow the pill. Just stay around this computer for detection, and then we can see what is happening in the small intestine.
The camera that is encapsulated in the pill and you ingest, so
Yeah.
that camera can look at our small intestines as well as our main intestines. Means all the
Yeah,
way.
basically it is used for mainly small intestine.
Oh, I see.
Because
Okay.
when it goes into the large intestine, the
Mm.
large intestine usually has a stool inside, and
Mm.
it's looking for that small capsule to see around.
Right, I see. Okay, well, that's really something.
Hmm.
Okay, shall we take a look at any more of the slides?
I think we have done with the slide. We probably can discuss some more uh, things.
Okay, no problem.
Yeah.
We've
So
got some
basically,
questions.
yeah, if you have any
Okay.
questions, we
Yes,
can
yes.
discuss.
We've got some questions from the
Yeah.
audience actually. So, okay, I'll just go on to the first one. Miss Karen Lim, her question is bright red blood in stool worse than darker blood, doctor? How long should I wait before going for professional help? Can it go away on its own? Okay, so bright red blood, is it more dangerous than darker blood? And how soon should she get professional help?
Actually, the brighter red blood could be dangerous than the darker blood, because the bright blood might come from artery. It it probably means it is a fresh bleeding, and it is probably bleeding, can bleed more than the darker blood. Darker blood, it looks like a venous blood. The bleeding is slower, or probably old blood. Basically, either bright red blood or darker blood, you need to see a doctor to have a proper checkup. But both can be dangerous, but the bright red blood probably more dangerous than the darker blood. Okay.
Okay, thank you. We hope that that answers your question, Miss Karen Lim. Okay, that's all the questions actually that we have today. Is there anything else that you would like to add? Maybe an advice, a piece of advice for people to come forward, because sometimes people do tend to not want to worry themselves, malu ke takut, and and they feel okay, it's
Yeah.
just going to go away the next day. But it's very, very important, right, for
Yeah.
them to come and check.
Number one, I think we have to go back to basic. We have to practice a healthy lifestyle.
Okay.
Take care of what we eat. Actually, our principle of food has changed from getting food to become healthier and to get the nutrition for our healthy body, to having food for just purely enjoyment. So we don't really look after what we eat and the content of what we eating. We just want to enjoy the food and forgetting that we need a good nutrition. And number two is make sure we drink enough, enough water. We should make sure that even the Ministry of Health has recommended this half of the plate that we having every day should contain vegetables and fruits. Okay, and this will ensure that we have a
Separuh.
healthy. Yes.
Yeah. Okay.
And pertaining to our topic today, which is rectal bleeding, when someone has a rectal bleeding, you need to see a doctor. Don't assume that you have some disease. Even as a doctor, we we can't really say what you are having when you have a rectal bleeding. Most people will, they have a doctor's friend or some doctor that they know, they will just give a call, send a message, doctor, I have a rectal bleeding. What do you think it is? It is not possible for us to say there and then what are the possible causes. You need to come and probably we have a private conversation and consultation, so nobody knows what it is. And don't be embarrassed, because when you talk to us, that is in a privacy, and you can explain to us what you're having. Then when you have a proper, what we call a diagnosis, find out what is the problem. Probably it's just a simple problem, at least you get a proper treatment. And with a proper treatment, this will prevent further complications. And we have all the equipments in Columbia HE Group. We have all this expertise and equipments to help you if you're having rectal bleeding, and this can be solved quite easily.
Okay, thank you very much. So that was Dr. Zulkarnain Hasan, who is the Consultant General Surgeon of Columbia Asia Hospital, Iskandar Puteri. He was talking about rectal bleeding, and I'm sure all of us have found that very informative. Thank you again, Doctor. And thank you everyone for joining us. We'll see you again another time. Thank you. Bye. Assalamualaikum.